Now, in the last couple of weeks, we've talked about tuberculosis, the Spanish flu, and even a little bit about the plague. All of those topics require that the sick be quarantined. But do you know how long the practice of quarantining has been around? Well, we're here to tell you about it. Let's begin with what exactly is quarantine? The CDC defines quarantine as the separation and restriction of the movement of people who were exposed to a contagious disease to see if they become sick, in which case they would have to isolate. Why is this important? Quarantine is one of the most effective tools in the public health tool bag. It stops the spread of disease between people. This creates a safe environment for our community by isolating individuals who are infectious from those who might have lifelong consequences from exposure to certain diseases. Many communicable diseases have significant incubation periods before symptom onset that, through quarantine, prevent others from becoming sick. Think of quarantine in regards to diseases like tuberculosis, the flu, and norovirus. If anyone with a compromised immune system contracts these diseases, they can become very ill and possibly die. But isolating for a short period to protect others is possible. The practice of quarantining began in the 14th century. It started as a way to protect coastal cities from any diseases that could be brought back from the travels of the sailors. For example, ships arriving in Venice from infected ports were required to sit at anchor for 40 days before landing. I wonder how those sailors passed the time. That's actually where the word quarantine comes from. Quarantine is a derivative from the Italian word quaranta giorni, which means 40 days. When quarantining began, it actually became a popular practice with pirates. Some of the most common diseases at the time were variola, or more commonly known today as smallpox, and yellow fever. In order for sailors to make a living, they all had to participate in the 40-day quarantine. However, quarantining every vessel that came into port was difficult and pointless when the ship had already performed quarantine at another city. To facilitate shipping, letters could be issued by a city where a ship had completed quarantine during their trip, which allowed them to have access to other ports without having to perform another full 40-day quarantine. During the golden age of piracy, permission to enter a city was called pratique, an early 17th century French term which comes from the Latin word practica, to practice. John Worledge defined this in his 1726 dictionary. Pratique, a license to traffic or trade granted to the master of a ship in the ports of Italy upon the bill of health, i.e. a certificate that the place whence he came was not annoyed with any infectious diseases. LOL, they had COVID cards. Quarantine, as the United States knows it today, began in 1878. Prior to that, the United States did little to prevent the import of infectious disease. The duty of protecting citizens from widespread disease fell on local and state jurisdiction and individual municipalities. The protections they enacted were less than uniform and sporadic. Regulations on arriving vessels did little in ways of stopping the spread of whatever it was the sailors picked up along their travels. With these regulations being so sporadic, continued outbreaks of yellow fever finally prompted Congress to pass federal quarantine legislation. So really, the United States has had quarantine mandates in place since 1878. Those mandates, however, didn't last very long. In 1892, continued outbreaks of cholera coming into the United States made it clear that the federal government needed to play a more active role in imposing quarantines. The following year, Congress passed legislation to clarify the federal role in quarantine. As local quarantine stations accepted federal help, more facilities were built, and the number of staff increased to provide better coverage. It was this system that was nationalized in 1921, when administration of the last quarantine station was transferred to the federal government, that we based our modern-day quarantine system on today. In 1944, the Public Health Service Act was established. The act gave the U.S. Public Health Service responsibility for preventing the introduction, transmission, and spread of communicable diseases from foreign countries into the United States. We still see quarantine today, as we have seen with COVID-19, though we do actually quarantine on a smaller scale with more common things like norovirus, strep throat, and influenza.